Hi, my name is Cassidy Phillips, founder and CEO of Trigger Point Performance. What I'm going to talk to you about today is hip and lower back discomfort and pain. We've had somebody email us and ask us what to actually do about that situation. Now, we do have our hip and lower back kit, and with that, it gives you the programming, the process. It actually gives you a breakdown of the biomechanics. But right now, what I want to provide to you is a very simple solution to understand why you may be having lower back pain, and at the end of the day, what you can do about it. Here's a very quick, simple analysis of what can contribute to lower back pain. Now, in life, you know, somebody as tall as he is or somebody as short as I am, I mean, it's just the reality. Biomechanics are biomechanics. Now, the difficulty is, as tall as he is, see, he's looking down to talk to me. It's one of those realities of life, right? So what will end up happening is you'll kind of lean down to talk to people. Now, what this does is it puts an effect on the knee and it puts an effect on the ankle when you're doing that. Just go ahead and stand straight up for me there and just kind of lean down that way. So you've got this weight distribution of the upper body. So that has to do with just your height. It's just what you get. The other side of the equation is just based off of biomechanics of life, what happens are the knees end up going forward. Go ahead and forward with the knees. The butt goes back and the pelvis tilts. Now go ahead and shift to the side for me there. Now let me explain this to you here real quick. What happens here is the knee, the foot, the hip are all strained because we're working on this weight distribution of the upper body. So here what we do is we're going to first address the lower leg so that you can get more dorsiflexion in the foot. Then we're going to go up into the quad area here, and what we're going to do here is redefine this link tension relationship between the hip and the knee. Now once we go there, we're going to go up into the psoas. So we're going to redefine this link tension relationship in the torso. We'll go into the piriformis. We'll hit major minor, and then we'll go into the T-spine. Now the reason we're doing all of this is because once you put this lordosis into the lower back, first we have to redefine the way that the foot hits the ground. Then we have to work our way up the kinetic chain, up the body. But if you see, we're putting kind of a false fulcrum right here into the lower back, right here into the L4-5 area. So what happens is you compress this area so you really start to shut off the neurological feed to the lower extremity. But up into the T-spine area, you're creating this false fulcrum here as well because you don't have anywhere else to move from. So what we're going to do by redefining the link tension relationships between these areas, once I give you more dorsiflexion in the foot, go ahead and stand up straight for me. Once we redefine the quad relationship, then we're going to allow you to lengthen the torso and have you stand up straight. Take care of yourself. Remember, a healthy body is a healthy mind. Look forward to talking to you next time.